Video blog. Subject: medical malpractice, bias in medicine, discrimination. I have shown doctors articles from the New England Journal of Medicine that clearly lays out the bias in medicine against minorities, black people, people of color, in terms of treatment, diagnosis, and prescription writing. Recently, the CDC has come out with guns blazing against pain medication, hydrocodone. I had an injury where I was hit by a car back in 1986, and I had to have arthroscopic surgery in my left knee. Both knees were injured. I knew it. They paid more attention to the left injury. And so when we did the settlement, I told my attorney that I'm going to have problems with this when I get older, so I'm not releasing the insurance company from liability later on in the future. And in fact, I have to look into that. So the doctor that I was seeing recently, a bone and joint doctor, told me that traumatic injury led to my knees feeling the way they feel now. So the thing is that they don't want to prescribe minorities pain meds. So the specialty for this practice is knee replacement, hip replacement, joint replacement. That's what they want to do. That's where their bread and butter is. I was getting shots, cortisone, steroidal shots in one knee. But I kept telling the guy both knees was hurting. He was giving me 80 micrograms or something in one knee, which helped some, but it didn't take the pain away completely. So the next time, months later, I convinced him to split it, 40-40 in each knee. And I think he gave me a series of shots 3 times over the year. And I was good with that as long as there was some kind of pain management along with it. But they don't want to write pain medicine for black people. So at some point, he would laugh and joke, and he kind of acknowledged that there was bias in medicine and stuff. And so he started to trust that, I wasn't abusing the medication. Since my specialty is addictions therapy, I have a master's degree, and I've worked in addiction, and I'm 32 years away from any kind of drink or drug. I could decide based on just relapsing or another theoretical approach about recovery, which is called rational recovery. I've been recovering for a while. I could say that I have enough awareness about myself that I can safely drink a glass of wine if I want to. The traditional line of addiction would say, no, that's not good. That's a dangerous theoretical approach to addiction. So the lunch is still out on that. I'm going to look into it some more. My aunt just had surgery on her arm. Initially, the doctor gave her something for pain, some hydrocodone. And then when she went back and needed more, he just looked at her and smiled and said, get something over the counter. She started to tell him some of the stuff she couldn't take. Maybe ibuprofen or something, an Advil or something like that. But she could take Tylenol. She shouldn't have said that. Tylenol is so deadly on the liver that it's a shame. And she's an elderly woman, so she's taking risks taking Tylenol. Doctors kill more patients and the pharmaceuticals with the regular drugs that they make and prescribe than they do with Schedule 3 and 2 medications and stuff. I don't know what politician said it recently, or now that in northern states, up around Vermont and places like that, white people are dying from heroin overdose. They're getting addicted to oxycontins and hydrocodone and stuff like that. Now they're talking about making an addiction a medical issue rather than a criminal issue, and decriminalizing all sorts of drug usage, including pharmaceutical. In my opinion, it should be, and stuff like that. But The Tea Party, when Obama was trying to get the affordable health care started, the Tea Party said, oh, we're going to have death panels. They're going to be deciding who's going to live and who's going to die. Well, guess the fuck what? They've already been doing that with black people all along, and they're still doing it. They are still doing it. There was an article in the news that they give black children less pain medication in hospitals than they do white children. So if blacks were driving the profit in the pharmaceutical industry around scheduled drugs, then the bottom would drop out. They wouldn't even be listed on Wall Street. So somebody's getting the good stuff, the morphine, the 10 milligram and up. And it's not black people. It's cold, calculated, biased discrimination in the medical field. And they've trained the black doctors to be just like they are. The black doctors are so scared, you know, they don't know what to do. And so they will treat you just like master treats you. So it's come to a point with me where I'm going to have to do a medical malpractice suit for, you know, basically what I've been going through and basically what minorities are going through, period, and have gone through for the longest. It's systemic, endemic, and it's there, and it's real. I would not disbelieve that, you know, they're harvesting body organs from a lot of lost people, black people that come up missing and stuff like that. That there's not any organ stealing going on with that, like in that area, and this traditionally, that's why black people aren't donors. They don't have I want to be a donor on their driver's license. We're already getting taken out by police in the street, so it's an easy thing for it to be in a doctor in the hospital and for them to just let you fucking die, so they can get a heart for somebody, for some white person or something like that, or a kidney. That's not beyond the pale, you know. And we have historical evidence to know that they will experiment on us. And the Tuskegee Institute thing, Tuskegee experiment, is just one. It's just one. So I want to know what, I'm going to try to find out what the Association of Black Social Workers is saying about this issue. And I am going to file a malpractice suit for the sake of our group, Medical Truth, medical literature and information that's out there that's saying this is what they're doing. And they keep saying, oh, we're getting sensitivity training and stuff around that. Bullshit. If they're getting it, it's not working. It's not taking. So, you know, for me, for us, peace out.